Okay, hello everybody. My name is David Gergen. I'm the Executive Director of this Academy, American Sleep and Breathing Academy. Okay, hello everybody. My name is David Gergen. I'm the Executive Director of this Academy, American Sleep and Breathing Academy. In the room tonight are NFL icons. Chuck Foreman, Minnesota Viking, Hall of Famer. Chuck led the NFL in receptions from the halfback spot. He revolutionized the game. Not only was he a leading rusher, he was also the leading receiver in his day. He was an NFL MVP. He helped the Vikings to 3 Super Bowls in 4 years. Chuck Foreman. Roy Green, two-way star, right there. Arizona Cardinals. He was known as the jet stream Roy Green. An interesting fact on Roy, 2 seasons, 29 touchdowns. It's pretty good numbers for a wide receiver. Now I'm going to tell you the number that's going to rock your world. Roy Green, yards per touchdown. Any guesses?
8.
8 yards per touchdown. Mark Walzek says 8. 30 over here by the Congressman. Here's the official statistic. 45.5 yards per touchdown. That's like half the football field. That's an incredible record that nobody broke. Next is a good friend, DK. Look at DK. Look at him there. Derek Kennard. All-pro offensive lineman, Arizona Cardinals, New Orleans Saints, and world champion Dallas Cowboys. Derek Kennard. Another local favorite, Mark, the Big Walzak. Tight end, long snapper, Arizona Cardinals, also known as the first man to get in a fight on the field. Right there, Mark Walzak. Our last player here is Eric Dickerson. Really, when you say Eric Dickerson, I mean, that says it all. He's still the single-season rushing record holder. No one's been able to beat it. And it's really an amazing feat that what Eric's done. But moreover, Eric is a gentleman. I mean, the guy is a true gentleman. He's taught me a lot about being a better person. You know what? I'm gonna hand the mic to Eric because he's gonna tell you a little something about Dr. Harry Sugg.
Dave, grab that mic, could you?
Well, I met Dr. Suggs a couple of years ago through Dave Gergen and my friend Roy Green. They talked about this guy, Dr. Suggs, in Dallas, Texas. And I went to school at SMU in Dallas. And I need some dental work done. I think all of us do, but I needed it pretty badly. And I talked to him on the phone, on Dr. Suggs, telling me to come into Dallas to get the work done. And I'm like, okay. And when you're kind of apprehensive, you don't know a dentist. I think everyone has a fear of a dentist. I mean, I know I do. Like most people like me, they have a fear of going to the dentist. So finally I went out and I'm trying to find his office. And I'm riding, I had my navigation on, and I go by and I see a sign that says, Wheeling Dental, welcome to Eric Dickerson. That's how I saw it. I'm like, oh, that's my name right there. Okay. So I go, I told him that every time I go there, I said, Doc, I'm kind of disappointed my name's not on there. I'm kind of nervous. I'm glad to see my name up there. Right? So anyway, I go in to his office, and he made me feel, very much at home. And I gotta say this, Dr. Suggs, like I said, I'm always been leery of dentists, but man, you're the best dentist in the world for me. I can say that. You're a great guy. Your staff is top notch. I mean, I say top notch, I mean top notch. And just like myself, like all these great players here, we have done all the things that we've done in the National Football League. But then you've done for me, for Roy, for all of us. Seriously, I just want to say thank you. And For me, it's been life-changing. I know we still have a long way to go. We have a long way to go. But honestly, I just got to say, you know, you make it so easy coming in to see you. You always have a smile on your face. You're a guy that works hard all the time. And I told you, I said, you just told me you're 76 years old. I'm like, man, I know I won't be around when I'm 76, but if I am, I sure want to look like you, Dr. Sugg. I should.
No, it's right here.
Hold on, get up here. I'm holding up. We got something for you guys. You know, I was fortunate enough to be inducted into the Hall of Fame in 1999. You know, for me, you don't get a feat like that by yourself. You just don't. It's guys like all the guys you saw standing over here, you know, that played with you, played against the guys that blocked for you, ran around for you. Same with you, Dr. Suggs, the same the people who work for you. Like I said, you have a top-notch staff. And you know, I was fortunate, like I said, to get in the Hall of Fame. And we have something for you, Dr. Suggs, we want to show you, present you with, because to me, and when it comes to dentistry, to me, you are a Hall of Fame doctor. So,
Dr. Sugg.
For me, a guy who has sleep apnea, who hasn't slept well in years, and when I met Dr. Suggs and David Gergen here, and I tried the mask and all that kind of stuff, and I had my mouthpieces, not pretty, don't get me wrong. My daughter said, "Damn, you look like Frankenstein." But I can say this much here, it has helped me sleep so much better at night with the mouthpiece that you guys made for me. So I just want to thank you, Doc, and I want to thank you too, David. So, Doc, congratulations. Good to have us on.
Thank you, Rick. You'd like to say some words about Dr. Sugg?
I just wanted to say a few words about Dr. Suggs here. Dr. Suggs practically saved my life. I was well over 465 pounds. I am 120 pounds lighter now. I sleep through the night every night. I have tremendous energy. Dr. Suggs has saved my life with this device that he has made for me. And Dr. Suggs does something that some people don't understand, and sometimes I don't understand, but it's about the patients. Dr. Suggs is there at his office for more than 12 to 16 hours a day, providing services for his patients. This man has dedicated his life to dentistry, sleep apnea, and to his patients. So this means much more to me than probably to anybody else in here, but thank you, Dr. Suggs.
Dr. Harry Hill's son in the Sleep Apnea Hall of Fame. Thank you.
Sleep apnea literally means without breath. It can cause fragmented sleep, shorter lifespan, reduced quality of life, and even death. It is estimated that left untreated, sleep apnea can reduce lifespan 7 to 15 years. At Lone Star Dental Sleep Medicine, Dr. Harry Sugg screens and treats patients with obstructive sleep apnea.
Sleep apnea is where you stop breathing for a certain number of times per hour. If you wake up several times an hour, then your body never gets into deep sleep. You never get the REM sleep. Your body never gets like reconstituted at night. Your body and your brain files all the activities that you had that day, and it can't do it, and it affects your memory. You can't remember names, you can't remember instances, because your body never got the opportunity to get into that filing cabinet because you never got into the deep enough sleep. When someone goes to sleep and they're laying there in the bed, the body says, relax. And all of your systems start slowing down. Your muscles start relaxing, your whole body starts relaxing. When that happens, your airway starts closing down as well.
Basically, when you sleep, air travels through your mouth, down your throat, into your lungs. The narrowest part of the airway is at the junction, where the soft palate, the tongue, and the back of the throat all compete for the same space. When you are awake, the muscles are tight, keeping the airway open. But when you sleep, these same muscles relax, causing the airway to narrow. As the air passes through the narrowed opening, the uvula and the surrounding tissue begin to vibrate, causing a condition known as snoring. If the tongue continues to fall back, it can cause the breathing to become slowed or completely stopped. This is known as obstructive sleep apnea. More than 18 million Americans suffer from obstructive sleep apnea. 90% go undiagnosed.
Snoring is sort of a telltale sign. Because you snore does not make you an apneic, but it's like a forerunner to future problems on there. So snoring should not be ignored. Multiple times we have especially men that come in and they say, I don't snore at all. And the wife is with them and she said, oh yes you do. You sound like a freight train.
A study from the Mayo Clinic found that spouses of snorers woke up at least partially an average of 21 times an hour, nearly as often as the 27 times the snorers woke up from sleep apnea.
Person who has apnea, they think they're asleep. They don't hear themselves stop breathing. They don't hear themselves snoring. So it's real important to interview the bed partner because they're the one that really knows what's going on.
Other signs can include sweating during the night, fatigue during the day, morning headaches, suddenly waking up unable to breathe, waking up feeling tired, losing interest in sex, feeling sleepy during the day, falling asleep at work, school, or church, or while driving, restless sleep, tossing and turning, and concern that your quality of life is affected by fatigue.
Certainly one of the first things is that you wake up tired in the morning. And sometimes you have a headache, sometimes you don't, but it's just hard to get up. You don't feel refreshed from a good night's sleep. You feel like you worked all night and you just can't get it going.
And the list of serious health problems is long. Obstructive sleep apnea is associated with an increased risk of cardiovascular disease, high blood pressure, diabetes, stroke, and arrhythmias.
The comorbidities can include high blood pressure, diabetes, any kind of cardiovascular problems. And so people need to really take this seriously. The science is all behind this. The key is to be tested. You're not going to know if you're an apneic unless you're tested. Here in the office, we do pre-screening, and then we send you to a sleep lab, and the sleep lab does a definitive study, and they make it as comfortable as possible. It's a nice bed, and they make it look like a bedroom, and so it's just about the same as sleeping in your own bed at night.
Along with the sleep lab test, Dr. Sugg uses the latest technology to get a full picture of the patient's airway.
We do a physical examination of your airway to see if you've got an open or constricted airway. We also do something called a cone beam, and a cone beam is very sophisticated equipment that tells us with a calculus computation exactly the minimum size of your airway. When we send you for a sleep test, we're 99% sure that you're an apneic and you're not going for nothing. The cone beam CAT scan is a marvelous piece of equipment that we can just test the upper part of the airway without exposing the rest of the body to any radiation, and we get all sorts of findings.
And if a patient has obstructive sleep apnea, the two most commonly used treatment options are the CPAP machine or an oral appliance.
The machine is blowing air into your nose and into your lungs on a continuous basis. And so you're breathing with it, and you're also breathing against it. And it holds the airway open. And it's excellent for the people that can tolerate it, but there is just a very small percentage of people who can actually wear it and wear it successfully. If a person has been diagnosed with a CPAP and they are having trouble tolerating it, which most people do, it's very easy for us to make an oral appliance for them that they can wear.
The Academy of Sleep Medicine issued an official statement that a dental appliance can be used as the first line of treatment for mild and moderate sleep apnea and as an alternative to the CPAP for severe sleep apnea.
What this device does is it slightly moves the lower jaw forward, the tongue comes with it, and keeps the airway open.
The oral appliance is comfortable and easy to wear. Most people take only a couple of weeks to adjust to wearing the appliance. It is small and convenient, and the treatment is reversible and non-invasive.
An oral appliance fits people's lifestyle because people are used to wearing bleaching trays, night guards, TMJ splints, and so we find that people have a much higher tolerance for wearing an oral appliance than they have wearing a face mask.
The Academy of Sleep Medicine reports oral appliances are the #1 non-surgical alternative for CPAP intolerance.
One of the things that happens occasionally is someone drops it, breaks it, the dog eats it, or whatever. And we had a man not too long ago that he could still wear it. It needed repairing, but he would not turn it loose for one day, one night to get the thing repaired. And so he's wearing it right now, broken, because once he had that thing, he did not want to give it up even for one night.
Dr. Sugg treats children as well with sleep apnea. While the testing is the same, the symptoms and treatment can be different in a child.
Yes, children do get sleep apnea. In fact, so many times sudden infant death syndrome, where children die in the crib, so much of that is an airway issue, an undiagnosed airway issue. We treat many young children that are snoring, that are having airway problems, that are having trouble in school. Once we get their airway open, they are a completely different person. They go back to school happy. They start making good grades. They physically and mentally grow. They're taller, and their brain grows larger. In other words, they're actually taller and smarter as an adult.
Young and old alike, Dr. Sugg says once a patient gets the quality sleep they need, everything improves.
I hear every single day what a difference it makes in people's lives. In the people that are around them, they are not just happier, but everybody around them is happier. Their boss is happier with them. Their spouse, their children, everybody's happier.
I was a free agent. The Cowboys picked me up after 3 years in New Orleans. It was mid-November, back in '95. So he flew me out of here, and I went to Dallas, and we signed, and We won the championship that year against the Pittsburgh Steelers. Dallas, Texas. You know, I love Dallas. Dallas is a wonderful place. I just love the Dallas, Texas, period. It's just a country town that just the country in you just wants to come out and play. Dr. Suggs and I got together about sleep apnea, and through a mutual friend, he wanted to find out what happened in order for me to get involved with sleep apnea.
I'm working with Derek in order to work with the NFL players. They are also subject to sleep apnea. They're big, they're heavy, they have constricted airways, especially the linemen. The linemen are like 4 times more likely to have cardiovascular problems. And so the statistics are adding 7 to 15 years to your life. I think in the case of retired NFL players, I think it's much, much greater than that.
Pro Player Health Alliance has merged with all the 32 cities in the NFL that has an NFL team in it. Pro Player Health Alliance has merged together with the dental industry in each city to allow former and current players to get treated for sleep apnea. And this allows them to go in and get an exam, get checked out.
One of the reasons that we've zeroed in on retired NFL players is these guys don't live as long as the average population. You think of these guys as, you know, top physical condition, nothing can happen to these guys, but it does. They die years younger than the normal population. And so that's one of the reasons we've zeroed in on this, is to be able to help these guys and not have them die. I mean, you just don't see retired NFL players living to be 90. I mean, it just doesn't happen. And the linemen have a very short lifespan after they retire. So many of these guys die, they die within years after retirement.
This is really going to help all my former NFL players. It means a great deal to me because we have guys passing away and dying soon after they retire, and sleep apnea has a great deal to do with it. And so there's so many of them that have sleep apnea, and most don't know they have sleep apnea. They think it's a way of life.
And what happens is that when people have sleep apnea, they gasp for air. And so the body goes into what's called a fight or flight syndrome. And at that time, it's like if you get scared and all of a sudden you get a big adrenaline rush and a pit in your stomach. Well, this happens over and over and over all during the night, multiple times. And so it's that shot of adrenaline that's so hard on the heart, it can be not a secondary, but a primary cause of heart cardiovascular problems, and it's also a primary cause of diabetes, type 2 diabetes. We're going to be doing some screenings next month where we will have a number of them come in, and we will screen them for obstructive sleep apnea. I'm also working with a cardiologist. We're going to be doing this at the same time at the screening, and so we're hoping that we can catch these guys in time. You know, one of the things that Derek had told me was that, didn't you tell me that you felt like you could have played 4 or 5 more years?
I could have played many more years beyond the years I played, the 11 years I did play in the NFL. I probably could have played an additional 5 to maybe even 6 years if I've had a decent night's sleep. I've been suffering from sleep apnea for a long time. With the absence of not sleeping and the sleep deprivation, no telling how long I could have played. Staying focused, being alert, being aware of what's happening on a daily basis, paying attention to the details could have really been helpful to my longevity in the NFL. But you know, I'm not crying over about it, but over spilled milk. I love Harry. Harry is a wonderful man. He's compassionate about what he does, and you know, Harry is in his element when he is working, and he's also really caring about adding to the life of young men like myself. That a guy that has played 10 years or more in the NFL have a lifespan of 52. I just turned 50. I want to live a lot longer than 52. Meeting Dr. Suggs to help me open my airways so I'm able to breathe at night and to have a full night's sleep. It's remarkable the things that Dr. Suggs is able to do to open that airway, to allow you to sleep through the night and wake up alert, feeling refreshed. I want everyone to have this fulfillment in life of enjoying a good quality of life beyond your playing years. Some of this stuff is hereditary, and there's not always big guys that have this sleep apnea. There's slim females, slim males. I have former defensive backs. Everyone knows the defensive backs are the slim guys out there, and I get calls all the time that they have sleep apnea. And so it's just not a big guy thing, but you know, most doctors say that us bigger guys have these big necks and we have sleep apnea, and most of us do. But the little guys has it as well, and we would like to get them treated. This means a great deal. Former NFL players, other people, to live a better quality of life and to add 7 to 15 years to your life by using the Herbst device. Why not? And this, you know, if I would have met Dr. Suggs and the people that is involved that helped me to sleep well, I could have saved my brother's life, and I wish we had an opportunity to redo this over again and meet everyone prior to my brother's death. I am very confident we could have saved his life. He left in his sleep, and after his autopsy was done, he says, your brother suffered from sleep apnea, and he died grasping for his breath. You can get treated for sleep apnea, whether it's you a former player, current player, or you're just an average Joe on the street that suffers from sleep apnea. You want to get treated. And this, you know, this is going to add years to your life. You're going to have a better quality of life. You're not going to be sleeping at the light like I was in your car. Are you kidding me? So I truly believe this is really going to add a better quality of life to just the average Joe. I think it's remarkable what he's doing. At the same time, he's saving lives. And Harry's compassionate about these young men that, I say young men because a lot of them are a lot younger than myself, but, but you know, if you're saving lives and you're helping people, and I think this is, you know, this is where Harry's heart is him and his wife just really cares about people.
I walked down the hall holding my face in pain.
I used to get headaches, shoulder pain, kind of cramping, earaches, and just a sick feeling.
The hardest thing is when you can't eat right. Well, it would give me headaches up the back of my head, you know, so I would be hurting. So it got to the point where I didn't want to eat.
Like many people, Mary Schaefer and Yola Young went to doctor after doctor seeking help. Their final stop on the road to healing Dr. Harry Sugg.
We see people that are on the verge of suicide. They talk about taking their life. They say, you know, if I thought that I had to live for the next 30 years just like I am right now, I'd just soon not live. So you got to get those folks comfortable and do it in a hurry.
Dr. Sugg was able to help these women and others like them through neuromuscular dentistry.
The goal of neuromuscular dentistry is to put the joint, the muscles, and the ligaments all back into a harmonious working position to where there is no strain on either the joint, the muscles, or the ligaments.
Dr. Sugg says there are a number of reasons why someone might have a misaligned bite, but he focuses on the solution, not the cause. After extensive testing, Dr. Sugg is able to treat the problem.
There's a variety of options, and it depends on the severity of the case. It can be all the way from an appliance that's only worn at night, and the problems are not that severe, and that pretty much takes care of it.
For more severe cases, Dr. Sugg creates an oral appliance called an orthotic. This device keeps the jaw in alignment. The results?
They're not living in misery every minute of the day. Once they're comfortable, their whole lifestyle changes, their marriage changes, their work relation changes. Everything gets better for them.
I feel like I've been healed. I really do.
I can eat, I don't have headaches, I don't have pain. It's just wonderful. I wish I'd known about this maybe 20 years ago.
Finally, I hit the right doctor at the right time, and I finally got it right. Dr. Sugg has changed my life. It was worth it, every penny.